Sore throats are another things that are very common in the urgent care. Right? Sometimes it's difficult to turn. Is it caused by a virus, like a cold virus, or is it a strep throat? Now, the majority of sore throats are caused by viruses, and you don't need antibiotics. How do you tell the difference? Usually those are the ones that are worse when you wake up first thing in the morning. Right? And as the day progresses, they get better. Right? Usually what you treat with, you don't have a fever. Usually it's something you take, some Tylenol or Advil for the pain. Again, drinking warm teas will help soothe that. Gargling with warm salt water. Our grandmothers are right. That helps it. You just need to do that 5 or 6 times a day. A strep throat, the difference is that strep throat is caused by a germ called Streptococcus. Right? It's a much more serious infection. Now, the two can still hurt almost equally the same. But classic with the strep throat, the patient's got a fever over 101. Their tonsils are enlarged. If you look at them in the mirror, you'll see they're red. They may have pus and yellow drainage on them and stuff. That's worthwhile seeing a doctor, right? Because the strep throat is one of the infections we want to treat with antibiotics. An untreated streptococcal infection can lead to rheumatic heart disease and something called rheumatic fever, which actually can cause some damage further down the road. So if you see those things, it's worth seeing your doctor. A lot of doctors have seen enough strep throats that when they look at it, they know it when they see it. But there's a lot of them that are not classic. They're not red yet. They look bad. And for those, it's worth getting a rapid strep test. This is a simple test. The nurse swabs your throat. Takes about 5 minutes to run. It's 90% accurate to determine if the person's really got a strep throat or not. The classic way to know if it's a strep throat would be to take a throat culture. That's going to be, again, swabbing the throat, sending that culture off usually to the hospital or to the lab. You're not going to get the results for 2 to 3 days. Right? But sometimes your doctor is going to want to do that anyway if the strep test is negative, but he still really suspects it's a strep throat and wants to document it. Once starting antibiotics, patient is usually some better the next day, and much better within 48 hours. They may not be back to normal for 5 days, but they're better. Right? They are contagious. So generally if someone comes in with a strep throat on Monday, we don't let the child go back to school until Wednesday. Again, everybody needs to wash their hands a lot. No one needs to eat after him or kiss the child. But that's something I see happens a lot. The parent is distraught because their child doesn't feel good and reaches over and kisses them right in front of me. And I have to tell them, guess what? You may have just got this.
Medtwice.com